Morfin. I'm on the faculty here at UC Davis, and I have had the opportunity to work with admissions. I think it's great to see everyone here. We have, I hope what I try to do with this presentation is just to give you my perspective. By no means does this represent, the one thing with admissions is that you can't clone people. So much of what we talk about admissions and speak about recommendations and prerequisites is dependent on each institution. So I think I'm just giving you my perspective in terms of, and then I'll go over in terms of a process on how to think about medical school. I think it's important to know before you start thinking about putting your application together about what the process is. And there's been a lot of changes, a lot of good changes that are happening in medical school admissions process, and it's translating into how we're preparing our students as undergraduates, and perhaps even how we're testing our students in our standardized exams to really get our students to think about how the new doctor should be. What should they be armed, and how should they be prepared to face the challenges we face as a country in our healthcare system. How many of you are applying to medical school right now? Okay. How many of you have applying next year? Right. How many want to apply to medical school? So I'll go ahead and get started. So I'll just do an outline. I really want to keep this a sort of a dialogue, so I really want to just kind of breeze somewhat through these lectures, through these slides, and I really want it really to have an interface and questions. I was out on the table and I was manning the internal medicine residency program table, and I got fielded really just did medical school admissions. So I know there's a lot of questions, so I really want to keep time for that, for questions for that. And so I wanted to go over just quickly some data, just I think it's good to know some trends that we're seeing by the AAMC. Our UC Davis School admission overview of the process, an introduction to holistic review, and then go a little bit about this EAM, which is an acronym for experiences, attributes, and metrics, and with a case study to kind of mirror it, just to give you an example of the sort of showing you at least what the concept is, but then in real time show you an example of an actual AMCAS application, how we think about sort of reviewing it and screening, etc. And then selection of schools, and we'll have some preguntas at the end, right? Some questions. All right, so let's get to it. The UC, this is a medical school data based from the AAMC, and you can see here that in the Burgundy's first-time applicants, so you can see that people reapply. So about a quarter of our students that get into medical school are actually reapplicants. They've applied before. So if you don't get into medical school, don't quit. And we especially need you. And I'll show you why. We need students like you. We need students that come from your background and who you represent and what you vouch to do. And if you look at the number of applications, what you'll see is that there has been a slowly increase since 2001. Since the Y2K period, there's been an increase. I mean, we've gone up to almost a 50% increase in the number of applications over the period of a decade plus. I actually applied to medical school in 96, 97, and that's when we had the peak number of applications. But soon we'll be past that peak. We've got to get applications up and up and up. And I think where people are realizing there's a lot of opportunities now. We're thinking about systems, we're thinking about different disciplines of that parallel in the MD degree, the public policy, the MBA, and so it's really an exciting time. A lot of barriers, a lot of challenges to face as a nation, but a lot of opportunities for in medicine. And here is some, now translating that into the people who are getting into medical school. So there you see the matriculants. This line represents the matriculants, people who've actually gotten into medical school. And right now we're looking at least in 2011 and 12, 43%. So about 40% of the students getting into medical school have the applications. So you're looking at, out of 5 students, you're getting 2 of them that are getting in, roughly. 2 out of 5. And you see the proportion number of men. This is national data. At our local chapter, our local university, we're actually seeing more women getting in than men. There's kind of the proportion, we're seeing that in more and more of our campuses, which is great. And if you look at thinking about getting into the we're California residents. We want to stay in California, right? But we don't have enough medical schools, right? We don't have enough medical school spots. So the UCs have tried to create this innovative program of private programs to create more spots, but still not nearly enough to accommodate all the students who are applying to medical school. So are those 5 students who are applying out of California residents, 2 of them are getting in, One of them is staying in California, the other one's going out of state. Okay, so those are those harsh realities of the numbers we're facing. Okay, just to kind of give you a sense of statistics. And then here's by race and ethnicity going across from 03 to 2012, again, AAMC data, and looking at the number of Latinos that are applying, and you can see we're pretty much flattened out at around 8 to 9%, and you see kind of the numbers, and this is kind of the discordance in terms of what our community looks like, the communities we're serving, and the representation we're having, and the lack thereof of the population. So again, really an important message that we need more of you. So what does our UC Davis School of Medicine admissions process look like? And this year we broke 6,000. This is the highest number of applications I've seen since I've been there. And we have 6,000 applications, and our spots are not growing. We're at 105. We actually, a few years back, went from 93 to 105 to accommodate some of our programs that were focused on prime underserved communities. And so you can see how things break up in our timeline when we're interviewing. We're doing an MMI, the multi-minute interview. I'm sure there's been a workshop on that. Those are sort of how things break out. And so if you look at where do you have your biggest chance is you get to the interview. When you get to the interview, you got roughly about 1 in 2 to get into medical school. It's 105, but usually we have to accept over 200 to get 105. So it's usually medicals tends to gravitate towards the same type of students. So if you get into the interview, you have a pretty good chance, 1 out of 2 to get into medical school. And I would say this is consistent with a lot of the other medical schools in terms of how their numbers would look. Here's a little bit about the admissions process at UC Davis. And once you get your application, there's a filter. The filter set based on GPA, MCAT. But the one thing I'll say that perhaps may not be relevant in other schools is that we do a manual review. Of those 6,000 applications we had, every single one got their personal statement read or at least looked at. So this manual review down here in that red circle, we're able to screen those applications and be able to perhaps rescue some of them and to move them over to the secondary application and be able to offer them a supplemental application. And then the screeners, then we do the invitation, and then we do the interview, selection committee. But I think the point here is that manual review is critical, especially when we start thinking about holistic review and looking beyond the metrics. There's a reason why the metrics, I'll show you, the metrics is actually the third letter of that acronym. It's EAM, not the other way around. I mean, we really focus on, although our initial filter is based, but we really have an emphasis on trying to really think about, and we really do training for our faculty and to really think about along these lines, and think of the other intangibles that go into an applicant and what they have to offer to the field of medicine. And here's a roadmap. This may be clear to some of you. This is really from the LMSA report in 2010 as sort of a position, roadmap of how to think about integrating holistic review practices in medical school admissions process. In addition to that, they've, I think, visited over 50 campuses now doing these workshops where the campuses offer LMC leadership comes and they do these workshops for all faculty members. So much of medicine can be very cultural, it can be very institutionalized. And so the idea here is to start thinking about different creative ways of thinking, how do we think about populations, how do we think about students from these populations, how do we think broadly about these populations and these applicants, and not be so handcuffed with numbers and GPAs. You know, there's clear inequities in terms of who does well on the MCAT, who doesn't do well on the MCAT. And so I think those are the things that have been important to really think about, and this has got so much attention. And this is kind of a review of how the experiences, attributes, and metrics. And I'll go through what each of them an example of what each of them would be. And this is kind of a schematic on how you're trying to perhaps really reframe how the institutions think about admissions and the type of students that they're selecting, and then obviously translating the workforce and the type of doctors you're going to be training. This is such an important issue. This is from April 2015, New England Journal of Medicine. Very prestigious journal, very high peer review and impact. That there was a perspective paper on this, holistic review, shaping the medical profession one applicant at a time. I think this was a really nice editorial, so if you have a chance to be able to Google this, pull this up, read it, it's fantastic. It talks about how you approach it, it talks about what the implications are in medical education, medical training. And again, so I think this idea of holistic review is really catching a lot of attention. schools are starting to implement it. I think the MMI is a direct kind of a way of getting at some of those intangibles that are not going to be available in the AMCAS, and trying to standardize the people that you do interview to give them the same interview and be able to bring out things that you otherwise would not see in a paper application or in a traditional interview. And let's talk about experiences. So experiences, I mean, this experiences, as a class, I think when we're thinking about experience, we're trying to think, what is the applicant's road travel? What are some of the things that make this applicant, him, or you've heard this before, it's the old cliche, what makes this applicant unique, right? And if you're a pre-med student or you're applying to medical school, you hear that word unique, unique, unique. What does that mean? Does that mean I have to go out and jump high dive off a 50-foot pole or something? I mean, that makes me unique. You know, and so I think the uniqueness, I think, has to be applied. It's got to be applied about, well, what is it that you've learned from it, and what are some of the experiences? These are some examples of where some of the experiences kind of could get at, sort of looking at your educational background, where you've worked, some of the research experience. This stuff seems pretty routine, but I think really as you start thinking about your application, I always think about applying to medical school. It's like running for office, okay? You're running for a very coveted position. There's a lot of students. You saw how many people across the country are wanting to go into medicine, how many people in this room want to go into medical school. So how are you going to position yourself and sell yourself and really represent yourself in a way that is you, genuine and authentic, but then has potential impact and appealability to an institution that may be looking for you. So, and a lot of that, you know, your message is framed based on the experiences you've done, populations you've worked with, could be at home, and so those are the things that kind of where you kind of put it together, right? Because I've seen applications, I think you could do up to 15 activities on an AMCAS, and you could fill them all up, you know, boom, 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 boom. It's like check, 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 check. But you have to add it. You have to make it synthesized. It's got to mean something, and you have to show it more than you tell it. You can tell all you want, but showing it comes out in the way you say it and how you do things. So educational disadvantage. So this question comes up often, because on the AMCAS you can designate if you're disadvantaged, non-disadvantaged. And I think this is an area that really is a hot button area in terms of what does disadvantaged status mean. And I think these are the definitions by AAMC and how you could fill it out. And social economic, again, independent of race. In California, we cannot use race-based, race-neutral. It's a race-neutral approach to admissions. But if you look at what are some of the barriers or what are some of the things that have impacted your educational advancement, and that could be socioeconomic. We know that socioeconomic status matters. It impacts who has access to the best schools, who's got access to the best fruit and vegetables, who's got the best access to colleges, who's got the means to be able to take a prep course, et cetera, et cetera, et cetera. That all matters. That makes a big difference. In education, you know, if you have parents that, like my parents, who went no more than the 6th grade in Mexico, you know, how are they going to be able to mentor me about this and that and this? You know, once I get past what my dad liked division. Once I got past division, that was it. I was on my own. So suboptimal K through 12, and so I think these are all things that we understand, and there's plenty of data, plenty of literature to support that these are the predictors. Medical, obviously if you have a medical ailment, you get an illness while you're in college, I mean that has an impact, right? You cannot compete against the others that don't have that. And social, there's marginalization. This is where perhaps some of these other things come into place in terms of marginalization, feeling marginalized based on race, gender, sexual orientation, where you've had directly been you felt that you've been not given an opportunity because of your identity and who you represent. So these are all things that kind of will factor in when you think about that disadvantaged statement. And I think it's not being homeless, it's not being, we think of it as the extremes, and it's relative to the pack, the average student. The average student getting to medical school across the country, 2 parents, at least one with a graduate degree, over $100,000 of family income. That is our medical students, okay? So you put yourself in that context, you're like, that's not me, right? And so those are the things that but it takes a little bit of mentorship, a little bit of introspection to really feel comfortable about this, because oftentimes there's this sort of stigma that, you're just checking the box. Well, you know, and this is why holistic is important, because we don't need to check the box. You know, we want to get rid of this statement. where we basically just fill out the demographic information, everybody does it, and you don't have to check the box because it's all there. And then we could translate it on the admission side based on all these factors. And we're actually at Davis actually looking at this and trying to come up with a way of quantifying, because on the LMSA application, you put down family income, you put down if you were the first to go to college, you put down your parental educational value levels, and then you do, and so those are the things that we've been able to look at internally to be able to capture the degree of being, their distance traveled is what we're using. So someone who's disadvantaged, it's not yes, no, it's a distance. Some people travel longer than other people. And so we want to come up with the ways of thinking about that, and which we know has an impact on educational. And then this is really in direct response to this proportion of metrics, you know. The average MCAT for Latino versus an average MCAT for a white person is different. You know, 21, 22 for Latino versus the average, right? So 27, those things make a difference. So how do we translate that, and how do we really think about the whole package, right? And here's an example. So now we're getting to now, you may not be able to see it, especially if you're really far away, but I'll try to do my best to bring up some. So this is what a actual real applicant, I've censored her name out, I put down some things in here, and I put down here in terms of what are some of the things. So this is what we look at in the demographics going to the educational disadvantage question, right? So here's where we're talking about the family income, how many in the household, looking at your fee-based, and this is all self-reported, right? This is not a tax document. We don't go ask for tax documents like you may need to as you go through your financial aid, but we will take your word for it, right? And then we'll look at this and we'll say, okay, this applicant had 30% financial need, she worked before the age of 18, she's family assistant, all these count as points, actually. And then we look at their parental, both parents got less than primary education like my parents. And so all this factors in, and we actually come up with the rating system internally to rate or say, oh, this student has, you know, an 80 out of 90 or 90, this student is disadvantaged. And so, and if you think about experiences, you start thinking of this is when you submit your application, and this is where you really need someone that you trust, and someone who knows you, and you can actually get someone who's just is going to check it just for grammar. You know, maybe not content, but check it just to make sure that you're not having any typos. There's nothing more discouraging than having typos and run-on sentences. I think that, you know, when people are critiquing your application, they're reading different pieces of it. And occasionally you'll have that one guy who likes to look for typos and count commas and sentences. So you want to make sure, not knowing who's going to read the application, because most of these applications, by the time you get into medical school, you've probably had a good 50 people look at your application, on one way or the other, okay? And so you have to make sure that it's the best thing you can put together, and then reading through it. So this applicant, for example, worked at Healthy Homes Program Outreach Coordinator, 16 hours. Here's the dates that she worked. And then you would also at UC Davis Medical Center, so you put down the dates. The dates are important to make sure they're internally consistent, especially when you fill out a supplemental application that you'll have once you've been offered. If you get offered a second application, some of these activities may come up again because you may be asked to write more about activity A or B or C. And so you want to make sure that you're consistent and you know, okay, what are the things that are important to know in your essay. So post-bac student in our program, did some partners in research projects, assistant, and wrote down in Children's Oakland, direct observation of lack of culturally appropriate group-specific language ethics in current generation of scientific researchers. This prompted me to develop the video, teaching manual and facilitator's guide for researchers and professional health professionals. So to kind of, and again, this is really as a way, as an inventory in a way. I mean, so the LMSA, the AMCATs now actually will allow you to write more on 3 activities on this primary application. So you could be more expansive on those 3 things. And what we do in our secondary, in our supplemental application, we may ask you to write about those 3 activities, and you may choose what are the 3 activities, going back to what am I about, what's my message, what do I have to offer to the medical school. That shows a lot of insight in terms of what you pick represent who you are, right? And so we really want you really to say, these are the things that represent me, and these are the things that I have to offer. Leadership, and community service, putting down a few things there for, And then, again, more community service. There's 60 hours, this is a 2-year commitment. And thinking about commitment, the one thing you don't see here, which you'll see later in the application, is when it comes to writing a letter of recommendation. And so when you have a long experience, 3 years, 4 years, for example, in a research lab, or working with closely with as a project coordinator, you would expect that you get a letter of recommendation. Okay, and if you don't get a letter of recommendation, that's usually a flag as far as I'm concerned, because it doesn't show there's a disconnect there, right? If you work somewhere for 3 years, that's something meaningful, especially if you talk about it in the essay, you talk about it in interviews, and there's no letter to substantiate that. Letters of evidence are just to give you, there it is, letter of evidence. It's gone from letter of recommendation to letters of evidence. So that's what we want. That's how you want to be thinking about when you're putting these activities down. There's things in here that that are again are really, you start noticing a theme. Guadalajara medical Spanish medical clinical intern early on. This is a 40-hour endeavor for about a month. Also, YMCA Spanish needs children parent support interpreter. Did that for 2 hours a week for a period of 2 years. Weekly Friday meetings proved to be a place where these struggling parents had a chance to talk and learn something about other parents and guests. Voice frustrations commonly shared amongst parents of this group together brought issues and find possible solutions how to deal with a parent to special needs kids, right? And it's like I was humbled to see that my transmission of English, Spanish, and Chinese helped understand and express the feelings that the monolingual parents could not have done otherwise. So you get it. I haven't got to the essay yet, right? You're already getting a feel for what perhaps the applicant has to offer. Was involved in a biological scholars program, which those who are from Berkeley know that's a really great program in terms of a pipeline program. They able to capture those students in their first 2 years who are underperformed, who come from underperforming high schools, I should say, and really knowing that first 2 years are critical to stay on this path to being pre-medical. Because chemistry is unforgiving, especially if you take chemistry at Berkeley. You really have to be able to capture these students and provide services. And not only that, but being a tutor. She's a tutor at BSP, gave back to the program, working with students who struggled in physics, like I did. In the 7th semester of tutoring, I created a website, archive to connect with students to other resources. I not only taught the material, but also translated, transcribed, and used 8 other resources for lessons that students would look forward to not having to decipher. Also went over and worked at Children's Oakland, right? Another great hospital, big clearly community there in Oakland, providing as a research associate, carried out high throughput assays during high-tech instruments and bioinformatics analysis of large data sets. So it's kind of a clinical, sort of clinically applied research, looking at data, statistics, working in a hospital that's really focused on underserved populations. Again, you're starting to kind of frame this woman has a lot to offer. And then working in the intramural stuff, I think this just shows balance. I think if you have things that are going to be, these things may not fit into your personal statement, they may not end up in your supplemental, but they're kind of an inventory. They're things that you've done that, who knows, you might have someone who's an athlete, who's a faculty member who may, oh, that's interesting, especially in the old traditional interview. This could happen. They have an open file, they look, oh, so you were on the soccer team, huh? And you might spend a fair amount of time on that, and and it's good, but there you go, how you see a disconnect in terms of not being consistent with all the other interviewers, right? So, but it should be placed there, especially if you were a team captain, shows leadership. Here's one of my goodies, oldies, and one of my favorites, because I was also a Che director at UC Davis. There's this activity listed, and again, focuses on Che, which is community Latinos in health education. She was a board member, so another thing that really adds and kind of substantiates and really is building on this theme of working. So here's a summary. The summary of her experiences are partners in research at Children's Oakland Hospital, culturally competent health, Healthy Homes Program Outreach Coordinator, Children's Oral Health Nutrition Project Coordinator, Santa Ana, El Salvador, YMCA Special Needs Translator, Che Treasurer, postback at UC Davis. If I'm at UC Davis, institutions like to promote themselves. How much time do I have? So institutions like they like, if you're attached to the university at some way or form, whether you went undergraduate there or you did a program through there, there's going to be an inherent bias towards, okay, this applicant, or not so much in the applicant, but the program. We know that the program is a good program, it's got a reputation of good, much like there perhaps is at the institutional level. You come from this school, from that school. And so that internally, I think, is something that is worth mentioning, this applicant, and then also the Biological Scholars Program tutor, which I think really adds in terms of giving back. She's received, now she's giving back. I think that tells about sort of this applicant's character. Now, attributes. So these attributes are things that, again, this looks like a list, and just want to give you an example of what attributes are. So these are kind of the intangibles. There's not going to be nothing in the application that says, tell me about your problem-solving skills. Why don't you tell me about your adaptability, persistence, integrity? Tell me about that. What activity level is that? So this really is going to be the stuff that is comes out sort of in the interview, comes out in terms of the acts that you're doing, which are the experiences, and letters of recommendations may comment, your interviews, like I said. So these are the things. Demographic, your things are set in stone. That's who you are, right? Those are the things that you outline. But these personal and professional attributes are things that you acquire. You acquire through experiences, and these experiences can be at home. They don't have to be an internship. They don't have to be a research position. I mean, something that really, again, shows insight. In order for you to bring these out, you have to sort of have a good sense of who you are and make sure at the core what you've done. And so these are the things that we try to get at, really, that really add some more to the applicant than just an academic portfolio and lists of experiences. So I think this is sort of the secret sauce, if you will. These are really, this are the characters. This is the characters that are hard to someone teach. These are things that you just kind of learn through life. And so personal statement. So this is, I don't know what you guys heard about the personal statement, but this is probably one of the hardest things I ever wrote, and I've had to write a number of these as I've gone through my professional training, going through residency and so on and so forth. But this one is a 23-year-old kid sitting in front of a pen and paper, having to think about what am I going to write, how am I going to do this, is tough, right? Because the fundamental question is not why doctor, but why you? Okay, why you? Why are you the chosen one? No. All right, why? The why part. And when I was a junior college transfer student, spent 3 years at Diablo Valley College, transferred to UC Davis, and someone asked me that question, I say, why you gotta get so personal? What do you mean? What are you talking about? I was like, I was flat-footed. Because quite frankly, I hadn't thought about it. I was just going through the motions. I was just grinding away like my dad did. Just my dad works hard, I work hard. But why am I doing what I'm doing? I didn't know. And I just, at that point, I was really hadn't had enough experience. I just hit the ground at UC Davis and took a couple classes, met a couple cool people, got to hang out with some couple cool people. The one thing about it is that if you don't know where you're going, which a lot of us don't know, hang out with someone who knows where they're going. Right? That's called find an advisor, find a mentor. And eventually you'll see the light, you'll know how to get there. But if you always know the road, then always remember there's someone behind you. Okay, so that's really where these personal comments are critical to kind of really, and we've all taken classes in writing, and there's many different ways of writing a paper. But this is just give you an example of this, and there's many different ways of entering, and so I would say is start off just writing, and you can spend a whole workshop on this personal statement, just write. With our post-bac programs that we have at UC Davis, we'll spend throughout, we learned early on that we couldn't just wait till the end of the summer to start writing this thing, that we needed to start thinking about it through our workshops, through our self-reflection, reading books together, talking about your experiences to one another, bringing in speakers to talk about their experiences, to find commonality, to bring out some of those things that perhaps you hadn't even identified. And then starting to write, journaling. And then slowly, those are the components that we start reflecting, we start putting together this, the taxonomy, if you will, of the personal statement. How this sentence goes to that sentence. But at least at least trying to build it for what it is. So this applicant basically started off with, I rushed my father to urgent care in Mexicali at 3 o'clock in the morning. At times he could mumble something in our native Chinese, but I heard excruciating pain in his voice. Okay, despite being hardworking immigrants chasing an American dream, our only recourse with no insurance or access to care in our Imperial Valley desert was to drive back to Mexico even in an emergency. Okay, so I mean that's sort of the opening line, and there's a few other things that you go through here. And again, you've read through the experiences, you've kind of seen some snapshots and some of the things, there's where she's been and who she is in terms of her profile. And then I think as you close a little closer, the things that stick out to me, and I mean, we have a lot of, like I said, a lot of applications to read. We have faculty members that read it, maybe medical students may read on our admissions, we have maybe residents. And so everybody kind of picks up on what they want to pick up. You know, if you have 5 faculty members, they may pick up different things, and maybe they were in tune with maybe some of the work she's done in research or some of the things she did at Children's Oakland. But the common theme that we try to come up with is what the discussion is, was basically sort of the things that kind of stick out in this personal statement was basically the first, I'll read it, it was the interactions as I advocated for my father's right to adequate health care that I found strength in my words and was empowered by my fluency in 3 languages to make a difference in the care of others. Then I shielded my family from the difficulty and frustration of navigating 2 different healthcare systems that were ill-prepared to treat low-income and uninsured and non-English speaking patients. The harsh reality did not discourage me. It nurtured my spirit to not stop at 0 options and ignited the spark to pursue a career in which I could provide health care for those populations. My determination not to allow setbacks equate to failure will translate when I face the challenges in providing care and solid answers to my patients. And so, I mean, this really kind of drives home everything she's done, the experiences, her own personal reflection, the transparency in which she brings out, right? The transparency she brings out, which takes a lot of reflection and in many ways, sometimes even therapy. There's some things we don't want to share, and that's one thing I want to say is that if you don't feel comfortable sharing it, don't share it. I won't tell you to share it, but there are things that can be very, very, very intimate, right? And you got to be able to talk about it, because if it's on that paper, you have to talk about it, right? And if you're not ready to talk about it because you haven't processed it, then that may be an uncomfortable and awkward encounter. Okay, so just wanted to make sure that I think reading through, and now we get to the last acronym letter, which is metric. We went through experiences, we went through attributes. You got to feel for this applicant, right? I mean, how many of you want to take this applicant to medical school? I mean, she's. The question is she qualified, right? Is she going to be able to cut the mustard, the metrics? And this is where we get into each institutional's own standards and perhaps biases on what should be the standard. And so fortunately the AAMC has this data. We have tables able to look at students who've been through medical school in a certain period of time and how that's translated to their success rates in medical school graduation, taking exams like standardized exams. You know, the standardized exams, oh, painful. Who's heard of the MCAT? Anyone heard of the MCAT before? The MCAT's this big mountain you have to get over. And so the MCAT, and you think about trying to get through that test, I think a lot of, we have to be able to have some proficiency. We have to be able to take a test and pass it. That's how we get licensed, okay? The MCAT just tends to be the hardest test I've ever took, all right? So just be aware, and in many ways, maybe that's the way it's designed, to weed people out. You know, 6,000 people applying, we gotta cut it out somewhere. But it's weeding our students out, okay? Weeding you guys out. And that's the thing you have to think about. Many students have to take it 2 times, and you know, the MCAT's changing. It's going to MR5. But guess what? The inequities will continue to exist between the students that are not disadvantaged and students that have had educational inequalities. There'll be a gap. It doesn't matter if it's MR6. So the idea is to do the best you possibly can and be prepared as possibly can. And that really is easier said than done because we're working, we're having to do all these things. But here's an example of what metrics, the word, the M and EAM, experience, attributes, metrics. The metrics, these are the things that fall in that category. And you'll see the GPA, MCAT, academic trend. I'll talk about that. the major, there's some, and not at UC Davis, but I know there's a general bias, a myth that you have to be a biological science major, that you can't be a non-science major. That's bogus, okay? About 40% of our students at our medical school are non-science majors. You obviously have to show that you can do well and you could actually perform in a high, rigorous science curriculum, anatomy, physiology, biochemistry, genetics, etc. But you don't have to be a science major. Quality of undergraduate institutions. Some institutions will not look at another institution. If you're at this school and you went from that undergraduate, forget about it. And then you look at their history of where they've gotten in, who they've taken, institutional bias. Okay, we need to break that down. Okay, so we have to look at institutions for what they are. I think if you take a class at this school versus a class in that school, doesn't mean that the other school is inferior. If you put the work in because you went to that school, because that's all you could afford, because the tuition's, you know, $1,200 a semester versus taking a $20,000. I mean, we got to start thinking about that. That's not the applicant's fault. That he took the class, he or she took the class, they did well, they should get credit for it. Okay? Quality of the essays, academic pursuits, things that are related to, you know, these are academic. You know, I'd say most of our faculty members come sort of from an old guard, they come from a traditional guard of academics and research, and so there is sometimes an over-enforce on that, and that gets down to the school's mission. That's why I'll get to it. It's important to know where your mission is and where the school's mission is. Do they align? Because there'll be some diversity in that. It's not going to be the same. So, but this is under metrics because that's where this category falls in when you start thinking for any given institution. The enthusiasm of the letters, I think this is where letters of evidence I call, are the ones that are critical here. The difficulty of undergraduate studies, course load, all these are all going to be up to arbitrary based on the reviewer, whether that's heavy, not heavy, these classes. But the application is pretty dense, so it's very hard to go box by box, looking at your classes, you know, looking at the description of your classes. But we generally look at the trends. We generally get a flavor for what the essays have to offer, what are the key components, the key experiences, and then looking at what the overall enthusiasm of the letters are, and then the metrics. So let's talk about the metrics a little bit more. So if you look at this table, this is a table that looks at people that got accepted to medical school at one place from 05 to 07, and you basically look at where their chances of getting into medical school. And you can see that based on your MCAT, so let's say the top group, 3.8 GPA and a 4.0 MCAT with an MCAT of, GPA of 3.8 and an MCAT of 39 to 45, 93% chance of getting into medical school. If you were in that number, there was about 911 people in that 2-year period that were in that bucket, in that top box, that corner box. All right, and now you go down and you look at the people in the middle, and you see, we'll just look at the third box down on GPA, through 3.4 and 3.59 GPA with the, let's say, 30, 32 on the MCAT. That tends to be kind of like the word on the street. That's the magic number, 3.5 undergraduate, and a 30, 32 on the MCAT. Well, 63% chance of getting in. Remember I said 43% of chance of getting into medical school, at least now. So, you know, your chances are actually pretty good. And this is all just looking at metrics, right? You're not taking into account experiences or attributes, but just gives you kind of a scope on how metric-driven the admissions process is across the country. Again, this is 05-07. This is before the report on holistic review. We weren't doing holistic review in 05-07, but these are basically what the trends were 05-07. Here's what, now, I like this table a lot because this table really translates MCAT GPA to really what we're most concerned about, okay, is are they going to pass step 1? Okay, we want them to pass step 1, which is the first step, those that don't know, is to take it after your second year of medical school. It's the first step towards getting your medical license. You need first out of 3. You take your first one your second year, the second one you take it in your 4th year, or at the beginning of your 4th year, and then you take the 3rd one at the end of your first internship. And that gives you your medical license. So if you can't pass this step, for most medical schools, they won't even let you go to year 3. You kind of have to retake the exam. So kind of a big deal, right, if you're a medical school and you're thinking about a STIRT student who has a lot of value, has a lot of experience, has a lot of potential with populations, really well presents well, interviews well. What is the academic risk. And so if you look at these scores, that they're actually not as bad as you would think. You know, the average passing rate for this test is close to about 93, 94%, and you click someone with a 3.2, 3.4 box, that's 4 boxes down on GPA, and the MCAT's right here, 27, 29, 94% chance of passing the USMLE Step 1 on your first attempt. That's not bad, right? So if you look at this, the blue is not so bad. You know, there actually was, believe it or not, in this analysis from 03 to 05, there was 32 students that were in the 2.4 to 2.6 GPA, and 27, 29 on the MCAT, 29 or 32 passed Step 1 on the first attempt. That's not bad, 91%. But there's only 32 of them. Very few people took a chance on it, right? Because of the bias of pushing people on the higher numbers. And then this is another good slide. Eventually, it's all blue. So the bottom line is that you get into medical school, people need heaven and earth to get you through. Okay, at least at UC Davis. We're in, you're one of us. The whole day of getting rid of you, put the eject button in general chemistry, get you out of school, that's not no more. Because we've invested in you, we've invested in the process, we're gonna make sure you graduate, okay? And here's this example, students will pass. So every school has their own sort of, has their own sort of culture and how they wanna, and who they feel comfortable in taking to their institution based on their own personal experience. But this is something that we continually discuss at UC Davis and continue to discuss, I think, across the country in terms of thinking about admissions and holistic reviews, because we know that our students from these communities are going to be, many of them may be in this mix right here. They may be right in here. They're probably in here somewhere. And the important thing is really not so much national data, but what is it at your institution? Because that's what's going to matter the most. What's your experience at your institution? Are you taking steps to make sure you're meeting the needs of this workforce? Or you meet the needs of these students? Okay, because if you're in it, you got to be in all the way. You just can't, okay, we'll take these students, it doesn't work out, okay, let's change our policies. These students don't work out. And so, unfortunately, we see a lot of that across the country. So that's really what we're trying to, and this is this student who, this is list where their undergraduate. The other thing I wanted to mention is those plots don't show post-backs, don't show a post-bac GPA, which I wanted to talk a little bit about, because this is where this AMCAS looks like. This came up at the tabling session earlier today, where you'll fill this out, you do your whole, I won't show you, but it shows all it computes all your semester grades, computes to a letter grade, and it computes your GPA per year, freshman, sophomore, junior, senior. Now, obviously, if you're doing 5 years or 6 years, it's going to be dispersed into a couple of different categories. And then here's your post-bac. You did our post-bac here, 3.82 in the post-bac, 26 hours. Our total GPA was 3.39. And those tables I was showing you, we really feel like the total GPA is probably going to be more meaningful than the BCPM. The BCPM is more like an eye test. It's good on the eye when you look at BCPM, but really the data really shows you might be looking at total GPA and also looking at total MCAT scores. I mean, think about it. If you're going to try to predict something, do you want to have as much data as you have, or just look at one sole subset? And so the verbal reasoning has always been a little bit of a crutch for us, because there's some schools that put the most emphasis on verbal reasoning, when you should look at the total MCAT, because that's more of a capture how high we've done compositely with 3 different standardized sections, and then you do the added score. So the added score actually counts the most, because we know that if you're not a native speaker, you're more likely to have a lower verbal score. And so this student had a 6 on the verbal, which I think in many schools would disqualify her to even be reviewed, because it was below the filter, right? But we're looking at total, post-bac 3.82, we're looking for upward trends, so we want to see that the students get stronger. We almost, sometimes predictably, will see our students struggle out of the gates. Even with pipeline programs, student support services, that first year, especially in a big university like Berkeley, our students may get slow out of the gates, but we want to see the students finishing strong. So again, that upward trend, I almost feel like they should actually reshuffle this table to show freshman, sophomore, junior, senior, so we can see that upward trend. Because if I show you upward trend, it looks like it's coming down. But anyways, that's my... So this is what the, where you capture the metric information. And so here's the answer. How many of you know this manuscript? Yeah? This book? Okay, this book is critical, okay? So you should read this book when you're thinking about applying to medical school, because it's not just you. It's not, yet they've been spending a lot about you and your AMCAS application, but it's also where you're going to be applying to. What do the schools look like? You know, what are the schools? What should I be thinking about the schools? And when you apply, here's some tips that I have. You could apply to 141 medical schools, but do not. Do not apply to all the schools, right? Do your homework. Go through the MSAR, look at the eligibility. There's a lot of details of who takes out of state, who doesn't take out of state. Go on, and now at this age, go on the website. I think a reasonable number is 15 to 20, and then apply for a fee waiver. Okay, if you get a fee waiver right off the bat, you'll get a fee waiver for supplemental applications. So you may not have to pay, you know, as you realize there's added fees. There's going to be a fee for the primary application for school, then there'll be a fee for each corresponding medical school. So you can really save a lot of money by applying this fee waiver. And to organize and track your program, this is something I emphasize with our students. You have to know where you're applying and make sure you're budgeting where you're applying. You know, I hear stories. People apply to 14 schools, they had 3 interviews, only went to 1 because they couldn't afford the other 2. And then they get into that medical school. My personal opinion, and I see it in my experience, has been 3 interviews. You get to 3 interviews, you probably have a better than 90% chance of getting into medical school, right? So you've got to capitalize on those interviews. And here's all this. This is an example of where you could apply. These are some really good schools that I've listed. Iowa, Cincinnati, George Washington. I just have not listed the best medical school on there, UC Davis. And then we have Sacramento. And so you list. This tracks you. This gives you deadlines. This tells you when to schedule interviews. And it keeps you sort of really in tune with where you're at and how you're progressing. Because you have to, you know, if you're working, going to school, you kind of have to know timelines. And so when we make sure those secondaries, one thing that I cannot emphasize enough, that supplemental application comes in, it's out. Right? In 48 hours, you get that thing out. Okay? Don't take it like a person. You already spent time on the personal statement. You spent 6 months on it. Don't spend 6 months on a supplemental application. Okay? Because most schools have a roll-in admission, and we can talk a little bit about that. But certainly, if the roll-in admission, the earlier you apply, the better. But you want to apply when you're ready. You want to apply when you're competitive, and that's where you need a lot of that information.